Viewers, welcome to your #1 health show, Healthzone, on Vagina TV. So tell us, what is G6PD deficiency?
Okay, thank you for having me on your show again.
Join me and my guests this and every Wednesday at 4 p.m. on Vagina TV. Vagina TV, connected to your world. Welcome to Health Tips Corner on Vagina TV. Our topic for this evening is vaginal candidiasis. So what is vaginal candidiasis? It is an infection caused by a yeast called Candida. Candida normally lives inside the body in places such as the mouth, throat, gut, and the vagina, and on the skin without causing any problems. Sometimes Candida can multiply and cause an infection if the environment inside the vagina changes in a way that encourages its growth. Candidiasis in the vagina is commonly called a vaginal yeast infection. Other names for the infections are vaginal candidiasis, vulvovaginal candidiasis, or candidal vaginitis. Symptoms include vaginal itching or soreness, pain during sexual intercourse, pain or discomfort when urinating, abnormal vaginal discharge. Although most vaginal candidiasis is mild, some women can develop severe infections involving redness, swelling, and cracks in the walls of the vagina. Contact your healthcare provider if you have any of these symptoms. These symptoms are similar to those of other types of vaginal infections, which are treated with different types of medicines. A healthcare provider can tell you if you have vaginal candidiasis and also how to treat it. Who gets vaginal candidiasis? Vaginal candidiasis is common, though more research is needed to understand how many women are affected. Women who are more likely to get vaginal candidiasis include those who are pregnant, those who use hormonal contraceptives, for example, birth control pills, have diabetes, have a weakened immune system, for example, due to HIV infection, or medicines that weaken the immune system, such as steroids and chemotherapy, and those who are taking or have recently taken antibiotics. They are also at risk. So how can we prevent vaginal candidiasis? Wearing cotton underwear might help reduce the chances of getting a yeast infection. Because taking antibiotics can lead to vaginal candidiasis, take these medicines only when prescribed and exactly as your healthcare provider tells you. So we move to diagnosis and testing. Healthcare providers usually diagnose vaginal candidiasis by taking a small sample of vaginal discharge to be examined under a microscope, and the medical office or sent to a laboratory for a fungal culture. However, a positive fungal culture does not always mean that Candida is causing symptoms, because some women can have Candida in the vagina without having any symptoms. Vaginal candidiasis is usually treated with antifungal medicine. For most infections, the treatment is an antifungal medicine applied inside the vagina of a single dose of fluconazole taken by mouth. Other treatments may be needed for infections that are more severe, that don't get better, or that keep coming back after getting better. That means it keeps recurring. These treatments include more doses of fluconazole taken by mouth or other medicines applied inside the vagina, such as boric acid, nystatin, or flucytosine. So don't hesitate to get treatment anytime you notice anything unusual, any unusual discharge, any unusual itchiness, any unusual smell. There's always treatment for this condition. And let's not be shy about it. Most of the time, these conditions get worse and show up in the most worst ways, because our women feel shy to go to the hospital to talk about some of these things. As women, some of these things do happen, and it happens to most women, yes. So if it's happening to you, it doesn't mean there's something wrong with you, or it's nothing to be shy about. Just quickly go to the hospital, report your symptoms, go under investigations, take your medications, and you will be good to go. Thank you so much for joining us on Health Tip Corner. Join us at the flip side as we discuss with Dr. Yennusom Maalug about his health screening exercise on Saturday. See you on the flip side. Viewers, welcome to your number one health show, Healthzone, on Vagina TV. So tell us, what is G6PD deficiency?
Okay. Thank you for having me on your show again.
This and every Wednesday at 4 p.m. on Vagina TV. Vagina TV, connected to your world. Good evening, viewers. Welcome to your number one health show, Healthzone, on Vagina TV. This is the first episode of season 3, and we have with us in the house Dr. Yennusom Maalug, head of the Health Project under the office of MP for Medina constituency. He's here to talk to us about the free medical outreach that is taking place on Saturday, 11th of December 2021. Welcome, Dr. Maalug.
Thank you very much, Rabi. Thanks for having me.
You're most welcome. So tell us, what inspired this program?
So this free medical outreach being organized by the Sosu Health Outreach team, which is under the office of the MP for Medina constituency, is to provide free medical care to people within the Medina constituency. The Health Project under the office of the MP, which has a mandate to carry out the health vision of the MP for Medina constituency, includes regular free medical outreaches within the constituency. So that's why we are going to carry out this free medical outreach. Aside the free medical outreaches, the other things that we do under the Health Project includes we provide what we call the Health Fund that provides financial assistance to constituents who have certain medical conditions but they don't have money to pay for their bills or can't afford the treatment for, say. We also do donations to health facilities within the constituency. We've done donations to Danfa Health Center. I remember early March this year, we did donations to them, disposable hospital equipment, surgical gowns, and other PPEs. Later on, that was just about a month ago, we donated 2 delivery beds to Danfa Health Center.
Wow.
We've also done other donations to Medina Polyclinic. We gave out some, various item medical equipment to them. That was in April this year. And actually, this free medical outreach, this is the second time we are having it. The first one was late March. I think that was in early April, 3rd April, that we had our first outreach. And that was in 2 electoral areas.
Oh, okay.
This time around, it's going to be in 4 electoral areas. We want to cover all electoral areas within the constituency before the MP is done with his first tenure as a member of parliament.
Oh, okay. That's very thoughtful of you. We'll come back to the areas. So what are some of the services that will be rendered during the free screening exercise?
So for this time around, like I said, we've expanded it to include 4 electoral areas. The services would include, we have free medical consultation. You come, we check your blood pressure, we check your weight, your blood sugar. We also have an additional list of free eye screening. And after your free medical consultation, the eye screening, We also have free medications that we provide. And we also have a health talk. We also have free mental health screening. The additional thing for this time around is that we will be registering constituents onto the NHIS, the National Health Insurance Scheme.
At the health screening exercise?
Yes.
Oh, wow.
So it will be for only the vulnerable. And we have classified the vulnerable to be the young under 5 and then the elderly above 70 years. And let me be quick to add that we also have COVID vaccinations at all the 4 centers that we are going to have this medical outreach. We will have vaccination for those who are coming to take their first dose. They haven't taken the vaccine at all. So we'll have it there. And if you've already taken your first dose and you are coming for second dose, we also provide that for you at all the 4 centers.
Oh, okay, that's very thoughtful. So you see, they would be having COVID vaccination as part of the free health screening exercise. And like he said, if you've not taken at all, you'd be given the first dose. If you've taken the first dose already and you've not taken the second dose, you can still go there and you'll be given the second dose if you fall within the catchment area where they are working around. So how many communities are you looking at? So
thank you very much for the question. So this medical outreach would be in 4 electoral areas within the Lam Kwantanan Medina municipality, which is also the Medina constituency. There will be 1 center at Teman electoral area, and to be at the Teman Basic School near the Teman Lorry Station. Okay. The initial location was going to be at the Teman Health Center, but we've since moved it to the Teman Lorry and the Teman Basic School near the Lorry Station. The second location would be at Okataban electoral area. It used to be part of Adenta new site, but that has now been carved out as Okataban electoral area. And that will be at the Pentecost Church near Adenta Pharmacy. Then the third location will be at North Legon, and we will have it at the Adonai Chapel or the Global Evangelical Church, the Adonai Chapel. The 4th location, that's the last location, is in Kwantanan East electoral area, and we'll have that at the Baba Yara School near the Mayehot Junction.
Okay, the project looks quite huge. So how is the setup going to be like? Because with all these electoral areas, I'm sure there are so many sub-areas under each electoral area. So how are you going to set up?
Right. So, I mean, it looks big, it's ambitious,
it looks really big.
But we have the experience. We did the first one when we didn't have any experience at all early this year in 2 electoral areas. So the setup, like we did the first time, when you get to the venue, there will be a registration point. We'll take your name, your demographics, your name, your age, your sex, and some other details. Then from that point, you move to the vital table where we have nurses checking your blood pressure, your weight. Then from that point, of course, your temperature would have been checked at the registration point.
Yeah.
From that point, you move to see the prescriber or the doctor, as the case may be.
Okay.
And the doctor you consult the doctor. After you are done, and the doctor wants to do certain investigations, let's say malaria test, you go to the lab station to do malaria test. And also for some people, who do blood sugar tests for them. So when you are done with seeing a doctor and you need medications, or you move to the pharmacy stand whereby medication will be provided. But after seeing the doctor, if you also want to see the eye clinic or go for an eye checkup, you go and see the eye people before you move to pharmacy, so that the medication will just be served at the same time. Whilst this is going on, the NHI's registration too will be going on, and then the COVID vaccination will be going on. But if you want to do the medical consultation and the eye clinic screening and finish before you do the COVID vaccination, that is also allowed. But you could also just walk in, register, and then go and do the COVID vaccination. So that's what the setup would be like.
Basically, it's going to be like a complete hospital setup.
Yeah.
Yeah, that's what it's going to be like. So what number of people are you estimating to reach by the end of the program?
So our target is to reach about 4,000 people.
4,000.
So we are looking at 1,000 people per electoral area or per center. And I think the numbers would even go up because of the COVID vaccination we've added to it, But that's what we are looking at, about 4,000 people, 1,000 per electoral area. Yeah.
So any reason why you added COVID vaccination to the screening exercise?
I mean, you know, the times we find ourselves in,
yeah, it's a
you know, and we are encouraging everybody to get vaccinated.
It's not been too easy for people to have access to vaccines and all those things. Most people, some even have had first dose since around March and have still not taken their second dose yet because it's become difficult to actually do that. So it's a great leap for you to be able to have access to give this out for free. You know, even though it's supposed to be for free, some are actually paying to get vaccines. Some are actually paying to get vaccines. So I'm very impressed.
Yes, so the COVID vaccination, when we brought out our initial flyer, people got in touch with the Honorable MP from Medina, Honorable Francis Xavier Sosu, whom we are working under his office, asking about where they could get their COVID vaccines done.
Everybody's worried about that.
Honorable got in touch with me as the head of the health project that, what can we do about this? People want information. So I quickly got in touch with certain people that I know do the COVID vaccination, and they said it is possible because they want to vaccinate as many people as they can get. So we have the Moderna vaccine available, we have Pfizer vaccine available, then we have AstraZeneca. Like I said,
you have all the vaccines available.
Yes, we have all those vaccines available. I think for Moderna and then AstraZeneca to be those kind for the second dose, because they've already given out the first dose. Then Pfizer would be first dose, you know. So like I said, those who have not been vaccinated, or even if you've been vaccinated, first dose, you can come for your second dose.
That's so special for a screening exercise. To be able to give COVID vaccination, I say thumbs up to you. Are there other projects under the office that you would like to talk about, aside the health project?
So under the office of the MP, Medina constituency, there are other projects aside the health project. You know, Honorable MP Francis Xavier Sosu, he is a visionary man who, even before becoming a parliamentarian, he had his vision on how he wants to run things, and that's how he's been running things. So immediately after elections, I remember we having a meeting and then setting up a committee to draw a policy document that will guide us to run, you know, his administration. So we have our flagship program, that's the Medina Job Center. You'd have heard a lot about it. That's our flagship program to take care of the unemployment situation within the municipality or the constituency. Aside the Medina Job Center, we have the Islam Project, which was set up mainly to provide some form of focus on our Islamic brothers or Muslim brothers to help with education, to help with, you know, outreaches, Ramadan outreaches, and also to help improve the makaranta of the Islam, is to see how we can, you know, make them better. Aside the Islam Project too, we have our educational project, which is known as the Edu Scheme. And the Edu Scheme, we are going to have the Best Teacher Awards soon. That will be 7th January. Aside from that, we have our educational, the QPRNI, the Quality Parliamentary Representation and Infrastructure.
Assalamu alaikum, Jama. Dr Rabiatu Wattigi, the Healthzone. Morenchenga Munkao Dr Yennusom Maalug, Head of Health Project, the Office of MP for Medina. So now the free medical health outreach on Saturday, like when no municipality. It's a one day free duka kana around Medina and its environs. Yes, kaya kaje kaje adubaka with free screening. Where is COVID vaccination kuma? It's a kind of baka aluru on COVID mba. You can also go there. Kaje aje adubaka. Saturday ni akache that's 11th of December. Time? You didn't mention time.
So the time is from 9 a.m. till 3 p.m. And I mean, we expect everybody who lives around to come. I mean, going around soliciting for support, there are some people who tell me that, look, they will be there, they haven't taken the vaccine, they will be there. Then other people are asking about the eye, is that they need to do the eye checkup. So everybody is invited. Let's come around and then get yourself screened.
Okay, thank you so much for your time, Dr. Maalug.
I want to thank all our sponsors and then supporters. Because there are some people who don't want to be known for good reasons. So we thank everybody and we encourage more people to come on board to support the Honorable Member of Parliament for Medina constituency, Lawyer Francis Xavier Sosu, to keep on providing, you know, all these good services to his constituents and then to Ghanaians at large.
Thank you so much for your time, and thank you for such a thoughtful project. We say thank you to Honorable Xavier Sosu for this wonderful project. Thank you so much. God richly bless you. This is where we draw the curtain on our program for today. Hopefully, join us same time next week at 4 p.m. Shout out to my producer, Ahmed Saeed, aka Dr. Vibe. Thank you so much for the constant support. I thank the whole Vagina crew. Meet us here same time next week, 4 p.m. Vagina TV, Healthzone. Salaam alaikum.
Malaikum salam.
Healthzone on Vagina TV. So tell us, what is G6PD deficiency?
Okay, thank you for having me on your show again.
Join me and my guests this and every Wednesday at 4 p.m. on Vagina TV.